So hi my scholars, welcome to today's class on the Cubital Fossa. Let's begin with definition of things. So I've been able to illustrate some diagrams in order for us to understand the concept of this depression. So this diagram is going to be telling us the boundaries, this diagram the contents, and this diagram describes what we see at the roof of the Cubital Fossa. Okay, so by way of introduction, the Cubital Fossa is a depression on the anterior aspect of the elbow. So cubital is derived from the word cubitus, and cubitus means elbow. A fossa is a depression in anatomy, or you can call it a hollow. Therefore, the cubital fossa is a depression on the anterior aspect of the elbow. That gives us our definition. Alright. So, what is the extent of this depression? So this depression extends from the upper part, from the lower part of the humerus. So right here are the epicondyle. So this is the medial epicondyle of the humerus. And this is the lateral epicondyle of the humerus. And this apex here is where we're having the upper end of radius and ulna. Upper end of radius and ulna. So therefore, the cubital fossa extends from the distal end of the humerus and the region of the epicondyles to the proximal parts of the radius and ulna. That is simply the extent of this depression. Alright. Now, with regard to the direction, this depression has a shape. So it is triangular in shape. The cubital fossa is triangular in shape. But we need to know the direction of this triangle. So it has an apex. The apex is directed downward. The apex is directed downwards. Why the base? The base is directed upward. The base is directed upward. Okay? And what forms the base of the cubital fossa? The base of the cubital fossa is formed by an imaginary line extending from the medial to the lateral epicondyle. An imaginary line connecting the two epicondyles is what forms the base of the cubital fossa. So the base of the superior border is this imaginary line extending from the lateral epicondyle to the medial epicondyle. That is the base. So if I draw an imaginary line here from the medial epicondyle, move this way to the lateral epicondyle, that gives me the base of the cubital fossa. Okay. So the boundaries of the cubital fossa. What are the structures that form the boundaries of the cubital fossa? You have some muscles doing that job right there. So those muscles include, from our key, this is the medial aspect, this is the lateral aspect. So this is the medial aspect. So this is going to be the medial epicondyle. Medial epicondyle. So there's this muscle that takes origin partly from the medial epicondyle, okay? And also from the lower aspect of the medial supracondylar ridge. What is that muscle called? It's called a pronator teres. So the medial boundary of the cubital fossa is formed by the pronator teres. But it is not all parts of the pronator teres, but the lateral part of the pronator teres. So you are going to have the pronator teres muscle. Pronator teres muscle. The pronator teres is supplied by the median nerve, and its major action is pronation. The pronator teres muscle. So you call it the lateral border of the pronator teres muscle. It forms the medial boundary of the cubital fossa. How about the lateral boundary of the cubital fossa? Of course, every triangle has two sides. So it's going to have two sides, an apex and a base. So what forms the lateral boundary of the cubital fossa? So we have this other muscle that is sandwiching this area. And this muscle is known as the brachioradialis. This muscle is called the brachioradialis. Remember the brachioradialis? One of those muscles that is going to be supplied by the radial nerve, okay? So the brachioradialis. So the medial border of the brachioradialis muscle is what forms the lateral boundary of the cubital fossa. Okay, how about the apex of the cubital fossa? This point right here. The apex of the cubital fossa is simply formed by the meeting point, the point of marital union of the pronator teres and the brachioradialis muscle. So where these muscles meet marks the apex of the cubital fossa. So you can see the apex right here. Okay. So at the apex of the cubital fossa, the brachioradialis overlaps the pronator teres. The brachioradialis overlaps the pronator teres. It is not their fault. The brachioradialis is trying to go and get its attachment, okay, at the base of the styloid process of the radius, while the pronator teres is also moving down, okay, to its level of insertion. So, and they meet at this point. All right. So this muscle is supplied by the radial nerve. This muscle is supplied by the medial nerve. We've discussed the apex. So the next is the floor of the cubital fossa. So what forms the floor of the cubital fossa? The floor of the cubital fossa is also formed by muscles. Okay, so one is going to form it superficially and one is going to form it deep. So the superficial part of the floor is formed by the brachialis. The brachialis. So the brachialis, okay, or the workhorse of the elbow joint, forms the floor of the cubital fossa at the upper part. And there's something you need to know about this muscle. So the brachialis is a muscle of the anterior compartment of the arm, and it has a very wide origin on the anterior aspect of the distal shaft of the humerus, and it goes down to insert at the ulnar tuberosity. That is the brachialis. The brachialis also receives double innervation, so it is supplied by the musculocutaneous nerve or the chief nerve of the anterior compartment of the arm, and the small lateral part of brachialis also receives innervation from the radial nerve, okay, from the radial nerve. So that is the brachialis muscle. So the lower part of the floor of the cubital fossa is formed by another muscle. So that muscle is the kind of opposite of this. And that muscle is called the supinator. Muscle. The supinator muscle lies deep in the floor of the cubital fossa. And the supinator muscle always appreciates the piercing of the deep branch of the radial nerve. What's that nerve called? The posterior interosseous nerve. So once the radial nerve divides into two branches, to two divisions, okay, at the level of the lateral epicondyle, the deep branch of the radial nerve or the posterior interosseous nerve pierces the substance of the supinator. All right. So that is what forms the floor of the cubital fossa. Up next, we need to know the roof of the cubital fossa. So the roof of the cubital fossa is formed from outside in by the skin, the superficial fascia. So we have the skin, the superficial fascia. The superficial fascia is not an empty vessel. It has some structures within it. The superficial fascia contains the following. So it contains the cephalic and the basilic veins. So this vein right here is the basilic vein. This vein right here is the cephalic vein or the cephalic vein. The cephalic vein. And this vein that runs proximomedially, connecting the cephalic to the basilic, this vein is called the medial cubital vein. The median cubital vein. So the medial cubital vein, which is the vein of choice in intravenous infusion, okay, it runs proximomedially, connecting the cephalic vein to the basilic vein, and that is high yield med scholars. All right, so that is the structures we are going to find the superficial fascia. Okay, in the superficial fascia, we're also going to find some nerves. So, and these are cutaneous nerves. Okay. So this nerve right here is the lateral cutaneous nerve of the forearm. The lateral cutaneous nerve of the forearm. And what is the lateral cutaneous nerve of the forearm? It is the nerve that supplies the skin over the lateral aspect of the forearm. And it is a continuation, or the distal continuation, or the terminal part of the musculocutaneous nerve. So this nerve is called the musculocutaneous nerve. Forms part of the root of the cubital fossa. Alright. So then we also have this second nerve. We have the lateral cutaneous nerve of forearm. This one is going to be called the medial cutaneous nerve of the forearm. So the medial cutaneous nerve of the forearm, or the medial cutaneous nerve of antebrachial. This nerve supplies the skin over the medial aspect of the forearm. And you know it is one of the branches coming from the medial cord of the brachial plexus. So it took a very long journey down here. A very faithful nerve at that. Alright. So while the third component of the roof of the cubital fossa is the deep fascia. The deep fascia. So the deep fascia of the cubital fossa, you know, the fascia is simply a kind of sheets of collagen fibers, okay, that helps in the organization of structures and comfort support. So this fascia, deep to the deep fascia, you are going to have a tendon. That tendon is called the tendon of biceps brachii. Okay, so this tendon of biceps brachii gave out an aponeurosis, and that aponeurosis is called the bicipital aponeurosis. So the bicipital aponeurosis is found within the deep fascia that forms part of the floor, part of the roof of the cubital fossa. So it's called the bicipital aponeurosis. Bicipital aponeurosis. Aponeurosis are flat sheets of collagen fibers, sheets of bundle of fibers that most times arise from tendons. So the bicipital aponeurosis. It's also called the Gauss Grace tendon. The bicipital aponeurosis is also called the Gauss Grace tendon. Alright. So we've discussed the structures that are forming the roof of the cubital fossa and the floor of the cubital fossa. So the cubital fossa is a space, and this space is situated at the anterior aspect of the elbow. So it has an important function, and the function is to allow for the passage of structures from the arm into the forearm. That is the most important function of the cubital fossa. So, and what are those structures? Those structures that are passing through the cubital fossa to enter the anterior aspects of the forearm. They form the contents of the cubital fossa. And that is what gave us this outline. The contents of the cubital fossa. So let's look at here. So the contents of the cubital fossa can be remembered with a mnemonic. That mnemonic is MBBR, from medial to lateral. From medial to lateral. MBBR, from medial to lateral. So this right here is the medial epicondyle. Okay? Why this is the lateral epicondyle. So from medial to lateral. This M is the medial nerve. So the medial nerve is one of the structures that is passing through the cubital fossa. This nerve is this one is the brachial artery. The brachial artery. Then we have the biceps brachii tendon. The biceps brachii tendon. And we have the radial nerve. So there's a peculiarity you should note here. That is because the most lateral content of the cubital fossa is a nerve, the radial nerve. And the most medial content of the cubital fossa is also a nerve, the medial nerve. Okay? While in between you have the two B's. The two B's are, first B is the brachial artery, and it's lying just lateral to the medial nerve. And then we have the biceps brachii tendon that is lying just medial to the radial nerve. And this is what gives you the contents of the cubital fossa. A very simple mnemonic to remember, okay? But I'm also interested, okay, in some events that are occurring at the level of the cubital fossa. I need to tell you this because you meet some of them in exams and you see them in multiple choice questions. So what happened to the medial nerve? So at the level of the cubital fossa, the medial nerve passes between the two heads of pronator teres. So median nerve passes between the two heads of pronator teres. That is what happens there. What happens to the brachial artery? Within the cubital fossa, at the level of the neck of radius, an event happened. The brachial artery bifurcated into the ulnar and the radial arteries, which are the terminal branches of the radial artery, of the brachial artery. So that is the second event that occurred. So the brachial artery decided to bifurcate, okay, at the level of the neck of the radius into ulnar artery and radial arteries. So that is what happens there. Then the third, for the biceps brachii tendon. Okay? So the tendon of the biceps brachii already gave off its aponeurosis, and that aponeurosis will form part of the roof of the cubital fossa. And the biceps brachii tendon lies medial to the radial nerve. Okay, take note of that. Then the radial nerve itself is one of the most important you should know. The radial nerve divided into a superficial radial branch and a deep radial nerve. So the radial nerve divided at the lateral epicondyle into the superficial radial nerve and the deep radial nerve. The superficial radial nerve will go to lie under the cover of the brachioradialis muscle, while the deep branch of the radial nerve, known as the posterior interosseous nerve, will pierce the supinator, pass between the two layers of the supinator, and enter the extensor compartment of the forearm. Within the extensor compartment of the forearm is going to lie posterior to the interosseous membrane, and it moves and supplies various extensors. We'll look at those muscles in another lecture. Alright, so these are the various events occurring at the level of the cubital fossa. What next? Clinical correlates. We have some clinical associations to the cubital fossa, and that is because the brachial artery pulsation can be felt at the level of the cubital fossa. So brachial artery pulses can be felt, and you could use this to actually check for the blood pressure of an individual. So you tie the cuff of the sphygmomanometer a few centimeters above the cubital fossa. You inflate, you deflate, you pick the pulse, and you know what the blood pressure is all about. Alright. So these are clinical associations. So what else at the level of the cubital fossa? Supracondylar fracture. If there's fracture of the supracondyles of the humerus, those bony prolongations that terminate in the form of expansions called epicondyles on the humerus, supracondylar fracture of the humerus can damage the structures that form the contents of the cubital fossa. So the median nerve can be damaged, the brachial artery can be damaged. In fact, it will lead to occlusion of the brachial artery and Volkmann's ischemic contracture. These are very important clinical highlights that you must know about the cubital fossa. And the last one, and one of the most important, is the median cubital vein that connects the basilic and the cephalic is the vein of choice for intravenous injection and for the collection of blood sample. Why? It's because this vein, first, is a large vein. Two, it is superficial. Number three, this vein is fixed. It's fixed by what is called the perforators. So the median cubital vein is fixed by the perforators, so it doesn't warp when you try to put in the syringe. So men scholars, have come to the end of the cubital fossa lecture. Thank you very much. Subscribe to this channel. Thank you.